Hi, everyone. Welcome to the Washington Days webinar. We're excited that you're joining us. We are going to get started in about 2 minutes. We're still waiting for some people to dial in, so just sit tight and we'll get started in a bit. Thank you.
Hello, everyone, and welcome again to the Washington Days webinar. We're very happy that you've joined us today. I'm Marla Feinstein, the Senior Policy and Healthcare Analyst here at NHS. Today, you'll be hearing from three of my esteemed colleagues, Joanna Gray, Beth Marshall, and Nathan Schaefer, who will go over everything you need to know about Washington Days. We will have time at the end to answer your questions, so please type your questions in the chat box or in the question box on the GoToMeeting menu. Now I'm going to turn it over to Nathan. Nathan?
Great. Thank you, Marla, and thank you, everyone, for joining us today. We wanted to start by just saying thank you. We know that last year, Washington Days broke all of the records. We had over 500 attendees from 47 states, and we had so much concern and anxiety and interest in what was going to happen with the Affordable Care Act. And you really heard the call to order, and you showed up in Washington and were amazing. And that was just the beginning. We had to fight against so many different versions of repeal and replace. And we know that we encourage community members to call your members of Congress and your senators in particular. We went back to Washington in June of last year and had representation from over 22 states. So we know that we have asked a lot of the community over the past year, and you absolutely delivered. You saw that there were floor speeches on both chambers where members of Congress shared anecdotes and information that they had heard directly from families with bleeding disorders. So we know that we had a decisive impact, and we also know that that was really exhausting. We asked you to call more than ever before, and you absolutely delivered. So on behalf of all the national organizations, we just really want to say thank you for your commitment and your ongoing commitment to protections of some really important patient protections. So what we're going to go over today is what to expect at Washington Days. So you're going to arrive on Wednesday morning, but you're going to have some information even before then. In addition to today's webinar, there are materials that are already available on our website. There are frequently asked questions, there is an agenda, there is a video of highlights from the past year. So if this is your first time, we really encourage you to comb through the website and read as much as you can with all of those materials. So like I said, you'll arrive Wednesday morning. And then starting at 3 o'clock on that Wednesday, March 7th, we will commence training. We will begin with social media training, which Beth is going to go into more detail in a few minutes, but we will cover everything you need to know about how to go up on the Hill the following day and be an effective advocate. We will walk through specifically what are the talking points, what are the priorities. You're going to hear more about that in a few moments when we turn it over to Joanna. But the point I want to emphasize is you will have ample opportunity to get all of the information and to ensure that you're going to be comfortable with what you'll be talking about. Wednesday, after we complete the training, you'll be with the members of your team that will all go to the Hill together the next morning. We strongly encourage you to speak with your team members on Wednesday evening and speak about who's going to talk about what and the order in which you will speak. You'll find that after you do a few of these, they become relatively routine. But for your first one, you really want to have a game plan about who's going to talk about what and in what order. And keep in mind, these meetings are quick. So everyone will need to convey what they want to convey, but do so succinctly because the meetings do happen very quickly. And you're going to have a schedule that we will provide to you. We will schedule all of your meetings for your Thursday on the Hill. Keep in mind that they can be close to one another. It's not uncommon to have a meeting, for example, at 11 and another one at 11:30. And we do our best to ensure that if you're going from one meeting to the next, it's in the same building. But it is possible for some of you that you will have to walk from the House side to the Senate side and back, which takes time. So the point I want to emphasize here is you have to be mindful of how long the meetings are taking because you can't be late to the next meeting on your schedule. We can answer any questions you have about what the meeting schedules will look like later on in the webinar. But you do not have to make any meetings by yourself. After all of your meetings conclude on Thursday afternoon, you'll come back to the hotel. We will have an evaluation form for you to complete, and then we'll all have dinner together. Friday morning, there is a state advocacy training that is required for all chapter folks, but anyone who attends Washington Days is welcome and encouraged to attend that Friday morning training. It ends by noon, so you can be out of DC in the afternoon. So you will be prepared. Like I said, you will have talking points. You will have time with your team members to speak about who's going to talk about what and in what order. And we will give you what we call leave behinds. These are pieces of paper that give background information and reiterate what are our priorities and why they're important to the bleeding disorders community. And it's very routine when advocates go to meet with legislative offices that they have materials that they leave behind. We also will be providing you personalized business cards that will include things like your phone number and your email, all of which you provided when you registered for Washington Days. It's very important that you make a connection with the people that you meet with and you have a way to communicate with them because you're going to be sending them a thank you note. We'll be sending them thank you notes on our behalf. But in the event that they have questions about what your family shared or anything about bleeding disorders, we want the legislative offices to be able to contact you. One of your goals whenever you go into a legislative advocacy situation, you want to become a resource. So you want to establish a connection and ensure that if they have additional questions, they can be in touch with you. Like I said, we'll give you all of that when you get there for registration on Wednesday. The next point that we want to emphasize is you will never be alone. This is a photo of the New York State contingent, and obviously they were all together to meet with their state senator, Chuck Schumer. But then throughout the day, they broke up into different groups because I see folks pictured here from Rochester, Long Island, and New York City, for example. And they would break up and go with those who are the constituents of their member of House throughout the day. But the point we want to make sure you hear is you'll never have to be alone. If you're the only person that's attending from your state, you will be paired with people from a neighboring state. And if you need it, there will be an NHF staff member who will join your team. So keep that in mind. Again, you do want to get together with your team and practice what you want to say, but you will not be alone when you're up on the Hill on Thursday. The next point we want to make sure everyone is aware of is that it is possible that you will meet directly with your member of the House of Representatives or your senator, but that's the exception more than it is the case. So a lot of times when folks have not gone up on the Hill before, they're disappointed when they meet with a member's staff or aides. And we want to make sure you're not disappointed, because here's the reality. Every member of Congress has to have a lot of, they have to have their knowledge base is expensive, because they have to cover things like energy and healthcare and tax reform and you name it. So they have specialized staff members who are the experts in their fields. You will be meeting with the person who handles health policy for the member of the House or the Senate. They will know more about the ins and outs of what Congress is up to as it pertains to healthcare than their boss in most cases. So you should not be disappointed. They are excellent representations of the office, and they are usually very bright and they work very, very hard. So please do not be disappointed. And keep in mind, they can get a lot done on behalf of the office. In most cases, members won't act on things unless their staff have advised them to do so. So they are experts in their fields, and they can be tremendous advocates. So don't be disappointed when you meet with staff. And don't ever say, oh, we're just meeting with you, because then they will approach the meeting as if they're just having a casual conversation. You need to take it very seriously. And again, don't be disappointed. Keep in mind, too, that the staff members are the ones that have to know the ins and outs of how legislation works. You don't have to know that. You are the only person who can tell your story. So you do not need to be an expert in healthcare reform. You're there to convey what your family has experienced. You're there to convey the complexity and the expensive nature of what it's like to treat a bleeding disorder. So think about how you want to convey what your family has gone through, and keep in mind, you don't have to be an expert. We also encourage you, if you want to bring your children, please do so. Children are great storytellers. This image here is a family from Maine, and they're meeting with Senator Susan Collins, and the young boy is explaining how his factor is administered. What a great way to convey what it's like to live with bleeding disorders, because by and large, members of Congress and their staff don't understand that you have to infuse to treat bleeding disorders, and that children have to learn how to do that at a very young age. And kids can be very, very effective messengers. I've seen young kids show their port, which is a great way for them to have a meaningful contribution without having to speak eloquently about any of the priorities. But the last thing I'll emphasize on this slide is, keep in mind, we do not provide childcare at any point during Washington Days. So if you want to bring your children, we encourage you to do so, but just keep in mind that you'll have to be responsible for them throughout the duration of the event. And keep in mind, you do have to move from one building to another, and you do have to go through metal detectors. It's not as stringent as the airport, but sometimes there can be long lines at the entrances to the legislative office building. So just keep that in mind if you're thinking about whether you want to bring your children. You will have to get them from point A to point B repeatedly, and it can be a very long day. The last slide that I'm going to cover is about things that you can bring along with you, or props, if you will. And remember, a picture says 1,000 words. So some things that we encourage people to bring. If you have expired factor that you want to bring, you see in the image here, the price amount is included there for how much factor that is. And that is a great way to convey, this is the vial that I have to take X number of times per week. Every one of these costs X amount of dollars. is a great way to convey just how costly and complicated it is to treat bleeding disorders. Feel free to bring a bill or an explanation of benefits from your insurance that can reiterate just how expensive treating a bleeding disorder can be, which is really, really important when we're talking about annual and lifetime caps, when we're able to say, hey, I met my annual cap in the first month of the year. And photos. You should think about bringing a few photos that really tell a story. Maybe it's a photo of the first time that your child infused himself at a camp. Maybe it's an image of a really difficult bleeding episode and you had to be hospitalized. Think about photos that communicate a specific point of your journey of living with a bleeding disorder. And think about a few, but not too many. I would say maybe around 5 would be effective. Anything more than 10 is probably overkill because you're just frankly not going to have that much time to go through so many photos. So think about a handful. So with that, I think I'm turning things over to Beth, but I will be here and I'm happy to answer questions later on. Thanks everybody again for joining today.
Nathan. So I'm going to talk a little bit about what to wear. It's really important because, as Nathan said, our meetings are very short. And so you don't have a ton of time, face time with the representative or the aide. So you really want to make a good impression. And also you're representing the entire bleeding disorders community. So the dress code in Washington is business dress. That's what the staffers will be wearing. That's what the representatives will be wearing. You do not have to wear business dress. You don't have to wear a suit. But I would basically sort of business casual is what we encourage. So for men, I would recommend a button-down shirt and then black or khaki pants. And then you could wear a sweater or a sport coat if you wanted to over the shirt. For women, a casual but comfortable dress is nice, or just, nice pants and a top. Washington is more conservative than many other places, so I would avoid anything that's too short or too low cut. For kids, we do often get a lot of questions on what kids should wear. Obviously, children are a little bit looser. It really depends on the age of your child and what it is that you can get them to wear. It always looks nice if they're a little bit dressed up, but sort of, first day of school clothes would be appropriate. But even, jeans are fine for little kids. So you just really want to use your best judgment and have them look presentable. So also, March is, as hopefully everybody knows, Bleeding Disorders Awareness Month, which means that we will be doing our Red Tie Challenge. So we are encouraging everyone to be able to wear the red tie. We're going to be bringing many, many red ties to Washington Days. We'll have ties for you. We'll have ties for the children. And so we're going to be so you might want to think about when you're planning on what it is you're going to wear that, know that you're going to be having this tie, and we are encouraging everyone to wear it. Last year, or the 2 years that we've been doing this, having everybody in the tie has really been a very effective advocacy tool. People remember them. People will remember, oh yeah, you're the family that came in the red ties year after year. It really does help make an impression. So that's why that's why we're continuing to do it, and we're not expecting you to bear it. So we will have the ties for you. But and one thing also, we have the first year that we launched the Red Tie Challenge, the red ties were part of our Washington Days ask. So we had red ties as leave behinds, and asked for the people to wear them when they were making floor speeches. We're not doing that this year, so we don't have the ties as leave behinds for your meetings. However, we'll have ties for you, and that should be plenty. Another thing I really want to stress, and this is from my own personal experience, really, really, really consider carefully what it is that you're going to wear on your feet. There is, as Nathan said, quite a bit of walking. The halls of Washington are beautiful and marble, but they're really unforgiving on your feet and your joints. So for women, really don't wear high heels. And for men, even the dress shoes with the thin soles can be pretty uncomfortable after a time. So I would really try to find some cushioned flats, some low-heeled shoes, get some gel inserts. But just remember that you're going to be on your feet for a lot of the day, and it can be some pretty unforgiving terrain. In light of that, or in reference to that, also, please note, we do have scooters available. So hopefully if you need a scooter, you registered for one, or when you registered, you said that you needed a scooter. If you're rethinking that, you can get in touch, and you didn't register for one, you can get in touch with our Conference and Travel Services Department. They will have sent you out a confirmation email, and then you can contact them and get a scooter that way. The other thing is, social media. Yeah, I will be doing at 3 o'clock on Wednesday a more extensive social media training, but just to, as a bit of a preview, we are going to be asking you to engage with your representatives on social media during Washington Days. We are going to give you the Twitter and Instagram handles of all of your reps. They are now, I mean, really about 90% of them are all on Twitter and Instagram. And social media is a really quick and easy way to thank your reps for meeting with you and hearing what it is that you have to say. We have a hashtag that we use every year, which is NHFWD. We encourage you to use that because we're going to be posting. We want you guys to be posting. We are going to be retweeting. We're going to be raising the volume of everything that you tweet out. So it really becomes a big fun Twitter party during Washington Days. So we really encourage everyone to join in and use the hashtag. And with that, we're going to turn it over to Joanna, who's going to drill into the issues.
Great. Thank you so much, Beth. And I want to start my part of today's presentation by echoing Nathan, who thanked everyone for all of your advocacy last year. You know, it was a pretty wild year. We called on you guys to make lots of phone calls, lots of emails. You know, we had a record-breaking crowd at Washington Days. We had a second, smaller, more targeted lobby day last year, and it was so inspiring to me to see all of your work. And it made me very proud to be part of this community, and want to also thank everyone who's planning to join us this year at Washington Days. As I'm going to talk about now, you know, we have different challenges than we were facing last year at this time, but we certainly are still facing challenges, and you coming to town and telling your story is going to be so important. I'm now going to briefly walk through the issues that we'll be discussing during Washington Days. And before I start, I just want to make one other kind of blanket comment, which is that this is just an introduction to what we're going to be talking about. You're going to get a lot more information in writing and during the briefing on Wednesday evening. So if we have any new advocates, looking at the list of folks on the webinar, it seems kind of 50-50, kind of folks who come a lot and are very experienced advocates, and there are several new faces. I don't want anyone to be worried about what I explain and that you need to memorize all of this. You really don't. We will provide you all the information that you need. We're going to focus in Washington Days this year on the need to maintain access to high quality insurance that provides access to the providers and treatments that people need to lead healthy lives, and supporting federal programs that support HTCs and benefit the community. So I'm going to now walk through both of those in a little more detail, but as you're thinking about preparing for Washington Days, I would encourage you to think about your own insurance coverage, you know, what has worked well, where you've had issues before ACA, you know, after ACA, and to think about your HTC, you know, what kind of services you get there, and if you've had any interaction with, CDC or other hemophilia programs. So that's kind of your homework, but let me walk through both issues in a little more detail. So first, thinking about ACA repeal and replace. Of course, last year was kind of a famously busy year in Congress, which considered multiple ACA repeal and or repeal and replace bills. All of them ultimately failed to pass the Senate, and I think that is thanks to the just, widespread grassroots advocacy. Senators' phones were ringing off the hook from folks who had concerns about the bills, including many from our community. One thing Congress did do was pass tax reform legislation that passed in December, and that bill, I guess now law, makes a bunch of changes to our tax system, and also repealed the individual mandate starting next year, so not till 2019. The effects of that policy, I think, will be diverse, and it hasn't quite shown effect yet, so there's more to come there. Thinking about Congress this year, there are several reasons for which I think it is very unlikely that there will be another kind of big ACA repeal and replace bill this year. One is that the new senator from Alabama, Democratic senator from Alabama, elected last fall, has narrowed the partisan split in the Senate even further, so it's 51 to 49. And most legislation to pass the Senate requires 60 votes. That means it has to be bipartisan, and there just has not been support among Democrats for any of the ACA repeal bills. So there's that. Of course, it's also an election year. The midterm elections are coming up this November, and I think there are lots of folks in Congress who want to avoid such a politically dicey issue right before their reelection campaigns kick off. That said, I think it's possible that there could be smaller ACA-related bills. There have been some that are introduced to try to stabilize health insurance markets. Some folks want to create new reinsurance pools to help insurers bear costs of high-cost individuals. So far, on the smaller ACA bill front, it's been a lot of talking, but nothing has really been considered seriously, and of course that's something that we are keeping an eye on. We will do our best to make sure that whatever Congress considers for insurance policies this year is responsive to our needs. On the administration side, when President Trump took office last year, his first executive order directed federal agencies to unwind the ACA, quote, to the extent possible by law. The Affordable Care Act is a very long law, but there are pieces of its implementation that are left to the discretion of the administration. So the Obama administration could shape the implementation of the ACA in lots of respects, and now that the Trump administration is running things, they can do the same. The general theme of where the Trump administration wants to go is more and more flexibility for states to set rules, and then more flexibility for plans. So there are folks in the Trump administration who think the ACA is way too prescriptive in telling both states and plans what they have to cover, what the rules are, et cetera. And so the administration wants to ease some of that. So that all started in 2017, and I think we will see that continue in 2018. There's a particular rule that I'm looking out for that was proposed last year and could be finalized between now and Washington Days, and if so, I'll certainly update you when you come to town. But there was a proposal to give states a lot more flexibility with respect to the essential health benefits. Why that matters for us is the essential health benefits are the 10 broad categories of services that plans have to cover. And what really matters to us is that lifetime limits are only banned for services defined as the essential health benefits. So if the administration were to give states a lot more flexibility to allow to narrow what's defined as essential health benefits, it undermines the protection of the ban on lifetime limits or annual limits, et cetera. So in the private insurance world, that's something that I'm certainly keeping an eye on. When it comes to Medicaid, there has been a lot more flexibility given to states in the last several months. And so depending on where you live, you may be hearing about plans in your state to implement work requirements for people who are on Medicaid, or potentially time limits. That so instead of being able to be on Medicaid for as long as your income would qualify you, it might be capped at, say, 5 years. And then theoretically, once you reached your 60th month of being on Medicaid, then you would be removed from the plan, which is obviously something that's very concerning. So what all of this means for our advocacy, as you're planning to come to town in a few weeks, I think the first thing we want to do is thank offices who opposed ACA repeal efforts. You know, NHS doesn't typically take big position or take comprehensive positions on big pieces of legislation. You know, for tax reform, for example, you know, this was a pretty massive bill. We opposed or supported particular provisions, but didn't come out and say, so support tax reform, oppose tax reform as the whole bill. It was support this piece or we're concerned about that piece. But when it came to the ACA repeal bills Congress was considering last year, they would have been so damaging to the community that NHS, along with all the other national bleeding disorders groups, I should say, did oppose the bills. And you can see a number of statements that we put out there all on the website if you're curious. But so I think the first thing we need to do is thank offices that opposed ACA repeal and contributed to those bills failing. I think we also need Congress to know that we are still paying attention. You know, Congress may have moved on to, I guess they were working on immigration reform this week. There's still rumors of a big infrastructure bill. You know, Congress, the headlines may have moved on to other things, but we are still laser focused on ensuring that our access to healthcare is maintained, and that we are going to stay in touch with them and continue to advocate for what matters to us. So we want them to know we are still keeping our eye on the ball. And so in line with the flexibility that I just described, you know, our main message is that there needs to be maintained federal standards. States and plans can't be given so much flexibility. There still need to be standards to make sure that we can access the insurance we need. So to be a little more specific, when it comes to the private insurance market, we are going to advocate for maintaining federal standards for the essential health benefits. I mentioned those a few moments ago. You know, the ban on lifetime and annual limits, limits on out-of-pocket expenses, the prohibition of discriminatory benefit design, those are all so important to ensuring that folks with bleeding disorders and anyone else with a rare, chronic, expensive condition, I should say, can actually access insurance and that it will cover what we need. You know, that's what the essential health benefits are all about, which is why it is so, so important. And I should say that a number of the bills Congress considered last year they did it in different ways, would have undermined the essential health benefits, would have removed those requirements entirely. You know, we want Congress to maintain the essential health benefits. And, you know, we may need Congress to tell the Trump administration that they need to maintain all the federal standards too, depending on how they proceed. So we're really focused there. Of course, the elimination of pre-existing conditions exclusions, also really important. You know, if you have a pre-existing condition, today plans have to offer you coverage and they can't charge you more based on your health status. Again, some of the bills under consideration last year would have allowed plans to set your rates based on your conditions or deny coverage entirely. And that, you know, that was the world before the ACA, and we certainly don't want that to come back. Coming to Medicaid, you know, the Medicaid expansion we know was very meaningful for the community. In states that expanded coverage, you know, single men were able to access coverage under Medicaid for the first time. And in fact, today, about a third of the community is insured by Medicaid. And so we want to make sure that both that the Medicaid expansion doesn't go anywhere, but that some of the other policies that have been proposed by states or by the Trump administration around work requirements, time limits, et cetera, that those or other policies aren't implemented that make it harder for folks on Medicaid to access the coverage they need. So our ask when it comes to maintaining access to insurance, we want Congress to preserve patient protections authorized by the ACA as I described, maintain the current federal standards for the essential health benefits, and maintain access to Medicaid. So changing tax a little, our second priority relates to federal hemophilia programs. There are a number of federal programs that support hemophilia treatment centers or the bleeding disorders community in other ways. And with everything that's happening with the federal budget, there have been 2 shutdowns in the past few weeks. It's been a particularly tumultuous budget year. We want to maintain our federal programs. So the first one is at the CDC. That there is a pot of funding that goes to HTCs for surveillance, data collection, and research. So folks who participate in the Community Counts surveillance program, that is funded by the CDC through this line. There's another pot of money that goes to support patient education and outreach programs. So NHF receives some funding for some of its programming. HFA has a cooperative agreement with CDC as well for some of its programs. There's also a lab at CDC that is really involved in a lot of inhibitor work. So the lab at CDC actually created a new way to test for inhibitors. Much of CDC's activity over the past few years has been focused on understanding inhibitors so that they can ultimately be prevented and eradicated. There was just an inhibitor summit that CDC put together last fall. It's been exciting. The CDC program was created during the HIV crisis, and CDC's activities have kind of evolved to respond to the inhibitor crisis, I guess I'll say, inhibitor situation today. Turning to HRSA, the Health Resources and Services Administration, HRSA provides funding to HTCs for services. The CDC funding that goes to HTCs is really about surveillance and data collection. HRSA funds clinical services that folks who go to HTCs receive. There are lots of services that HTCs provide that are not able to be reimbursed by insurance, such as the PT assessment, case management services, time with the social worker, phone calls to schools to help kind of navigate that for kids, et cetera. And so HRSA's funds support some of those services provided by HTCs. The other HRSA program that relates to HTCs is the 340B drug discount program. Via the 340B program, I'm sure folks on the call are aware of this. Some HTCs, about 100 of the 135 HTCs have pharmacy programs where they dispense clotting factor to patients. Because of the 340B drug discount, their participation in 340B, they are able to purchase drugs at a discount and then generate program income, which supports the multidisciplinary comprehensive care provided to all the patients at the center. The reason why we're going to talk a little bit about 340B at Washington Days this year among CDC and HRSA, is another federal program that is important to us, is because there has been some growing attention paid to 340B in Congress over the last few years, and there's been a lot of attention paid to hospitals. And we just need Congress to remember that while there may be thousands of hospitals participating in 340B, there's only 100 HTCs, but it's really important to HTCs and as HRSA grantees, and so we want to make sure that that can continue. So to be more precise, here is what our asks will be for federal programs. We want to support full funding of the programs at HRSA and CDC and support continued access to 340B for HTCs. I should say that President Trump released his budget earlier this week, and he's proposing a pretty dramatic cut for the CDC center where our activities are. So that's one concern there. He's proposing cuts to the HRSA grant program and elimination of some of the HRSA grants in our division of HRSA. There aren't a lot of specifics, so I don't know if the hemophilia program would be affected, but it might be. And some pretty significant changes for 340B as well. So all of this is on the Trump administration's agenda and is kind of at risk. Congress ultimately will decide what funding programs receive. And so we need to do our part to make sure that Congress knows that these are all really important to us because they're important to HTCs and important to the community. So with that, I think we will now open up for questions. And so Marla, let me turn it back to you to moderate the Q&A.
Thank you, Joanna. So the first question is about thank you notes. And the question is, will a Twitter thank you note, is for Joanna, will a Twitter thank you note cover it, or do we need separate thank you notes?
I do not think Twitter is sufficient. I think it's great when we can do social media to kind of beef up our advocacy, but we will ask you to send email thank you notes to the staff you meet with as well. I think it's a really crucial way of continuing to build the ongoing relationship as Nathan described. As folks who've come before know, we will draft a note and send it to you so that you have something to work off of. But yeah, unfortunately, I do think emails are required.
I would agree. I think the odds also of the person missing the tweet are high. So you would, they might not even see the Twitter thank you. So definitely email.
So this question is about, could be everyone, but I'll let Nathan answer it first. If we're talking to Democrats versus Republicans, do we have to speak differently about things to them?
Generally, I would say no. You're there to talk about what your family has gone through. You're not there to talk about politics. So you don't necessarily have to refine your message if you're going to a Democratic or Republican senators. But like Joanna said, one of the things we're going to be doing is thanking the folks that oppose the repeal and replace legislative efforts from last year. So you should know how they voted on those various measures. And if you have questions, we can, one of the staff members can help you on Wednesday of Washington Day. So like you have to know and memorize all of that right now. But we do want to know, particularly on the Senate side, where they voted last year. Joanna, would you add anything to that?
Yeah, I think, Nathan, I agree with everything that you said. We may kind of frame things a little bit differently for different offices, and we'll walk through that during the training so that you're prepared for that. We will also indicate on your schedules how your member voted, both on the House repeal bill and the Senate. There were so many bills in the Senate. It's a little bit trickier, but we will indicate on your schedule if they supported or opposed ACA repeal. So you won't need to do additional research, though I do encourage you just in kind of preparing for Washington Days to poke around your members of Congress's websites. You can see, if you don't follow them on social media, I would encourage you to do so. It's a way to see kind of what matters to them, the kind of things they're posting, the kind of press releases they're putting out, which may trigger something when you're in the meeting, a connection that you can make about that. It's another maybe small piece of homework I'd encourage folks to do before they come to town.
Thank you. And I think the next question is somewhat similar and has to do with legislative meetings. when will I know who is on my team and what my schedule is, Joanna?
Yeah, so as Nathan said, we arrange everybody into teams and we request the meetings for you. I will send a draft, I'll send an email with your draft schedule the weekend before Washington Days. So you'll get an email from me on Saturday or Sunday of that weekend, I guess the first weekend in March, that will have your draft schedule. Meetings times always change, and there may be some we haven't quite confirmed that we're still working on. So you'll get your final schedule when you come to at registration on Wednesday, but you'll have a hint of where things are headed the weekend before.
And I think it's imperative that everyone really remember that schedules do change, and they may change at the last minute. There's been years where Joanna has announced at the legislative briefing on Thursday, if you live in Kentucky, please come see me. So it's important to be flexible because this is highly dynamic all the time. And the next question is, with respect to staying on the talking points, can we take the liberty and add some talking points if we know that our issues are important?
So the short answer to that is no. NHF chooses the issues that we're going to focus on each year at Washington Days very carefully. And chooses the messaging around them, the specific talking points, very deliberately to be as effective as possible. And our expectation is that everyone who's participating in Washington Days is going to kind of stay on script, for lack of a better word. I want to encourage everyone to personalize the talking points. If we're talking about these programs that are supporting HTCs, I'd encourage you to talk about your specific HTC. Who do you see when you go? Why is it important? Was there a time when they helped you in an emergency? Et cetera, et cetera. If you had a lifetime cap on your insurance plan before it was removed by the ACA, and you had to change plans or change jobs, or if you're worried about pre-existing conditions, whatever, of everything we've just discussed, whatever kind of is most appealing to you that gets you jazzed, I'd encourage you to focus on that in your meetings. But no, you're not allowed to bring up other bills, bring up other issues, et cetera. The meetings, as Nathan said, are pretty brief, to maybe 20 to 30 minutes. There will be other people from your team who will have prepared to talk about the issues we're going to talk about. And the expectation is that everyone will focus on those. We also have everyone who participates in Washington Days complete a code of conduct, indicating that you will keep things confidential if you learn them about members of your team, and that you will kind of focus on the legislative priorities that we have identified. If you're in meetings with someone and they go off message or say something you think is concerning, there are folks at NHF you can reach out to, and kind of the ultimate potential is that folks could be not invited to come back next year to Washington Days in particular cases. So, we want to have the 450 people who are, or 485 or however many folks who are on my most recent list. We want you all to have a really great experience, and I think everybody singing from the same song sheet is a pretty crucial part of that. I'm not sure if the NHF folks have anything to add there.
Nathan?
I would say I agree with everything Joanna said. When you're reviewing the priorities and you're thinking about how this affects your family, I would really encourage you to think about how can you share a story that really illustrates why that point is important, how that priority has been, how it's affected your family. So think about, so you can diversify what you're going to talk about because you've all had different experiences. But think about a story that might really stick with the people that you're meeting with, so that when they're in conversations down the road and they're for example, maybe talking about annual and lifetime caps, and they remember, I met this family that lived with hemophilia, and they met their cap in the first 2 weeks of January. You know what I mean? You want to think about something that will really stick with them, but that is aligned with the priorities of what we're all sharing together on that day.
And I completely concur with all of that, because it's important to present, as we have in the past, a unified front, which makes us the foremost organization with respect to, these issues. So the next question is for Beth. For those of us that aren't connected to social media, such as Twitter and Instagram, is there a requirement?
It is not required. However, you've got some time. So if you want to download the Twitter app and Instagram app, it's a great fun way to get started using these. No, it's not required to use social media. We just encourage it because advocacy is a group effort that really lends itself to social media, and we've had a lot of success with it. You don't have to, but it's fun, and you will be #missing out.
Well said. And we did get another suggestion with respect to remembering things and about the talking point sheets being very dense, and we should consider, how can we answer all of the things, and how can we remember all the things, and maybe have ways to separate it out better.
Yeah, we one thing that we did, I think maybe 2 years ago for the first time, or maybe it was just last year. I think this will be my 10th Washington Days, so they all kind of run together, I will admit. But we had a cover sheet that had kind of in really big letters the 3 bullets of here's the 3 things we want Congress to do. So you can always have that in front of you as you're talking to kind of remind you about the bottom line. I would also say that, this is really about building a connection as advocates and as constituents of the offices you'll be visiting. So, if you get to talking about hemophilia and you're talking about your family and your experience, and, you realize that it's been 20 minutes and you haven't covered any of the 3 issues, and then all of a sudden the staffer says, oh, I'm so sorry, I've got to go. All of the details of the policy stuff are going to be in the folder that you will leave behind with them. So I wouldn't worry about kind of getting jumbled up there, because they'll have everything in writing, and we'll follow up with them too. But I think, we try to make it, there's this tension, right, between giving you a ton of information so you're prepared to answer questions and really feel comfortable, and not being overwhelming. How am I ever going to remember all that stuff that they said, and how am I ever going to say it all? And, we do our best to strike the balance in between.
I think that's a perfect example, and we do really spend a lot of time trying to figure it all out and how best to work within those time limitations and confines. So this question is more for Nathan. What will happen at the state training, and specifically, should I attend if I'm not currently affiliated with a chapter?
Yes, I would encourage all of you to attend. We will cover how you can start and build up a robust state advocacy program. So we will talk about successful legislative days at state houses across the country. There will be a panel that will be speaking about how they have built ambassador programs, which is the model that we've really been encouraging state advocacy programs to consider, where you have a number of ambassadors from the community who are able to reach more and more families and more advocates, and we'll share some success stories and lessons learned along the way. There will also be a training that focuses on Medicaid. Like Joanna said, a third of the community is now covered through Medicaid, and we've seen quite a number of cost containment measures being implemented across the country. So even if your state Medicaid program is functional and fine right now, that could change very, very soon. We've seen quite a number of measures being implemented across the country. So we'll give an overview of what we know is happening to Medicaid and what could happen to Medicaid in your state. Sometimes those policy changes can happen very fast without the intervention of a state legislature. So we're really trying to prime the community to be prepared to act on Medicaid-related issues. So we'll go into that in more detail. I know it's a long experience for Washington Days, and come Friday, folks are really tired, but we're going to do our best to make it lively and interactive, and it'll begin around 8:30, but it'll conclude by noon. So rest assured you'll have your afternoon and evening. You can begin your weekend. So that's a little bit about what to expect on Friday.
I concur. It is always fun. Washington Days is our most fun event. And with that, we are concluding our Washington Days webinar. We'd like to thank you for attending, and we look forward to seeing you guys in a couple of weeks. Thanks, everyone.
Thanks so much. Take care.
You too.